For over 40 years, the American Association of Suicidology, or AAS, has led the advancement of scientific and programmatic efforts in suicide prevention through research, education and training, the development of standards and resources, and survivor support services. Our latest initiative is the newly formed National Center for the Prevention of Youth Suicide. The National Center for the Prevention of Youth Suicide was started because the rate of suicide and suicide attempts among our youth remains unacceptably high. 4,500 youth die each year by suicide in the United States. As many of our kids die by suicide than from all natural causes combined. Suicide is the third leading cause of death among youth in the United States. The suicide of a child has a powerful impact. As many as 80 family members, relatives, friends, and classmates are intimately and directly impacted by each death. Over the last year, in an average-sized high school class, 2 students made suicide attempts. These numbers are unacceptable. Too many youth continue to attempt and die by suicide. AAS has recognized that there are significant gaps in our nation's existing efforts to prevent youth suicide. The goal of the National Center is to make a difference in our kids' lives by addressing these gaps. The National Center's battle cry is "No child lost to suicide." To do this, we will continue to target at-risk groups of youth known to have higher rates of suicidal behavior. For example, bullied youth, youth in foster care, and lesbian, gay, bisexual, and transgender youth. We engage 1 million youth as partners in our grassroots suicide prevention efforts. Youth are empowered to join us in our work. We also partner with other organizations by promoting greater awareness of the use of research-based approaches and training in suicide prevention. We are expanding the scope of youth suicide prevention to include earlier prevention, to promote the mental health and resilience of all youth, and to prevent risk factors. We are publicizing the warning signs of suicide through our website and web outreach to dramatically increase the proportion of youth at risk who are identified and referred for services. Early detection means lives saved. Youth suicide and suicidal behavior are complex problems that have no simple solutions. The stigma associated with suicide over centuries makes it difficult for individuals who are suffering from mental illness and who are at risk of suicide to seek professional help. This has to change. We can't address these issues alone. We must act, and act now, but we need your help. With your support, we will engage and work with new partners to create a more effective response. The National Center will forge collaborations with organizations previously unengaged in suicide prevention, particularly organizations with an interest in youth. Mobilize partnerships among existing suicide prevention programs to develop and disseminate consistent messages about youth suicide prevention to replace the often conflicting, inaccurate, and unhelpful public health messages currently disseminated. Initiate, support, and build grassroots youth suicide prevention campaigns by and among youth. Increase the visibility of the problem of youth suicide among groups working on cross-cutting issues such as violence and substance abuse prevention, and embed suicide prevention strategies in ongoing care and support systems. Your help will increase our capacity to make youth suicide prevention everyone's concern and to ensure that suicide prevention activities are widespread throughout the places where our kids are found, in every school, pediatrician's office, and youth recreation program. Your help will give us the resources we need to lead existing systems to change and to transform our communities. The American Association of Suicidology launched the National Center for the Prevention of Youth Suicide to reduce the rate of youth suicide attempts and deaths. With suicide as the third leading cause of death for youth, and with 4,500 youth dying by suicide each year, the National Center's 4 urgent objectives are: first, disseminating the warning signs of suicide to identify and refer at-risk youth to appropriate mental health care providers and support systems. Second, increasing the development and use of best and evidence-based suicide prevention practices among caregivers who serve youth. Third, reducing suicide and suicide attempts among targeted groups of youth known to be at higher risk, yet who are not addressed cohesively by existing prevention efforts. And fourth, building needed collaboration and dissemination strategies to prevent and address risk factors and to promote better mental health and resilience of all youth. Currently, the first 2 objectives are the focus of our work. The National Center educates youth, parents, and youth-serving adults about the suicide warning signs. These signs need to be as recognizable as the warning signs of a heart attack or diabetes, so that concerned individuals can intervene on behalf of their loved ones. Across a wide range of diseases and other dangerous behaviors, early detection of harmful symptoms has been shown to be essential to stopping bad outcomes before they happen. AAS is the organization that was responsible for bringing together clinical researchers to identify and formulate warning signs of suicide. The National Center is now responsible for disseminating these warning signs to wider audiences. We need to engage marketing professionals to help us reach our kids, whether they or their friends are at risk, and to reach those who are best positioned to observe at-risk youth, such as teachers, coaches, bus drivers, parents, family members, and medical and mental health workers, to name a few. We need these audiences to recognize the warning signs of suicide and learn to initiate an effective response in cases of suicide risk. Youth often confide suicidal feelings to friends, yet too often friends do not take these messages seriously or are not aware of the danger of keeping secret what they have heard. Knowing what to say, feeling reassured about telling a secret, and knowing to involve a trusted adult when asking for help are all important parts of preventing our youth from dying by suicide. To accomplish our second objective of reaching parents, professionals, and others who work with youth, a primary strategy is to develop web content. The National Center is working to develop a web presence that educates the public about the warning signs of suicide along with other critical information. Unfortunately, a recent review of other teen suicide prevention web pages found that the information was often inaccurate and misleading. The National Center has access to researchers, clinicians, and survivors through our parent organization, American Association of Suicidology, and can assure that every message is supported by research. Our web development plans are both short and long-term. For Phase 1, the National Center will disseminate most of the information, including advice, events, and resources, and will also promote our programs. We know the important content in research-based youth suicide prevention and want to enlist audience feedback in developing that information. For Phase 2, we will feature material from the youth themselves, such as moderated pages where youth submit guest posts to blogs or tell their stories. We plan to create a campaign to use social media like Facebook and Twitter to reach kids. We also plan to have interactive features, such as polling. For both phases, we plan to have videos, pictures, and an overall design that appeals to our new youthful audience. Sounds great, right? But for a small nonprofit organization like American Association of Suicidology, these plans stretch our technical and communications capacity. We know what we want, but we need professional assistance to build a website that will meet our communication goals. Although we have defined our primary audience, we have a range of stakeholders and users to consider. Your support will help fund the marketing and technology components of our goals that will catapult our message to millions in need of knowing more about saving lives of youth who are at risk for suicide. For over 40 years, the American Association of Suicidology has networked with individuals and organizations involved in suicide prevention. AAS has great credibility and a strong reputation as the oldest national organization devoted to this cause. The National Center for the Prevention of Youth Suicide, as a program of AAS, is uniquely positioned to lead a new consortium of youth suicide prevention organizations. With your support, the National Center will develop and lead the Action Collaborative with other youth suicide prevention organizations from the United States and Canada. As far as we know, no one yet has attempted this. Let me explain how we will leverage your strategic investment. Currently, there are many youth suicide prevention organizations all over North America. Many are focused on building public awareness, yet across organizations there is not a consistent message. That's where we will start, and where we will maximize your investment. Instead of a single organization working to build public awareness, we will have multiple organizations across North America spreading a unified message of hope and help. To start, a goal for the Action Collaborative will be to define the issue and develop a clear message. The National Center identified some key kernels in its initial discussions with other organization representatives. We are losing youth to suicide at an intolerable rate, and suicide is usually preventable. With your support, the collaborative will develop a communications strategy for social change. Funding will allow consultation with communications and marketing professionals to get an external perspective and expert advice. One purpose in building awareness is to develop stakeholders who will become involved in suicide prevention in their local communities, states, tribes, or provinces. These stakeholders will contribute to the growth of a movement, contributing their time, resources, and experience to youth suicide prevention. The Action Collaborative is somewhat risky. First of all, because youth suicide prevention movement has never before developed a coordinated communications strategy. And second of all, because the issue of suicide is highly stigmatized. However, your help will enable us to stand on the shoulders of previous prevention movements. Suicide prevention has a tremendous amount to gain from developing this project. Once the Action Collaborative has developed coordinated messaging, the National Center will lead work with the group to develop common products such as training units and awareness material. AAS is effective because key board members, association members, and staff at the American Association of Suicidology planned strategically for the National Center for the Prevention of Youth Suicide. Our members and leaders include academic experts as well as experiential experts, those who have lost their children to suicide. The experts' environmental scan identified a number of systems, issues, and gaps. Through an iterative process, AAS developed 5 essential outcomes and a work plan. First, the long-term overarching outcome that inspires all our work is a reduction in youth suicide attempts and deaths. Second, a crucial strategy is the reduction of suicides and suicide attempts among targeted groups of youth known to be at higher risk. The National Center has begun by focusing on youth in foster care, bullied youth, and lesbian, gay, bisexual, and transgender youth. We are promoting best practices training and developing practice standards and tools, such as assessment instruments, with national organizations that target these youth. Third, expansion of existing suicide prevention paradigm beyond saving youth in crisis to developing a prevention approach that promotes mental health and resilience in all youth. The National Center initiated and will co-sponsor a national institute as a first step toward building interest and increasing the number of stakeholders in upstream prevention. Fourth, an increase in the development and use of best and evidence-based suicide prevention practices among youth-serving clinical workers and other caregivers. The National Center began with the evidence-based warning signs of suicide and best practices for intervention. This information is available for parents, caregivers, and other youth-serving adults, as well as for our youth and their friends. Fifth, an increase in youth stakeholders and an increase in their knowledge that suicide is preventable. The National Center began outreach to high school students and staff, plus developed initial web pages for easy access. The National Center leveraged the impact of disseminating information by leading a consortium of numerous small youth suicide prevention organizations to develop consistent messaging. The National Center Director reports these outcomes regularly to the AAS Director. At a yearly meeting with the board with representatives from clinical, research, and survivor divisions, outcomes are reviewed and updated. The National Center will also present evaluation results at national conferences related to at-risk youth or suicide. But a key outcome, engaging the hearts and minds of youth and young adults, as well as the adults who love and care for them, engaging them around a highly stigmatized issue like suicide is an outcome that we are currently grappling with. With your help, we can build the critical mass necessary to create a social movement dedicated to saving lives. The National Center for the Prevention of Youth Suicide at the American Association of Suicidology is developing a success dashboard that includes outcome and process measures. Our overarching goal is long-term, national reduction in youth suicide attempts and deaths. An intermediate goal is a long-term pilot project within a finite system, such as a school system or geographic area. A strategy goal is a long-term reduction in youth suicide attempts and deaths among youth known to be at higher risk, such as youth in foster care, bullied youth, and lesbian, gay, bisexual, and transgender youth. A first step is a pilot project with demonstrated success. Specific outcome and process measures for the National Center include web content, practice standards, and trainings about suicide prevention among agencies that serve groups of youth at higher risk for suicide that are targeted by the National Center, as well as funding for a pilot project. Newly developed, evaluated programs that exemplify the expanded earlier upstream suicide prevention paradigm, which promotes mental health and addresses risk factors earlier in a youth's development. Journal articles, media accounts, trainings, and web coverage, such as blogs and e-newsletters, about upstream youth suicide prevention that will be established by the Institute Planning Group. The number of best and evidence-based suicide prevention practices through web material and trainings, such as web surveys and training follow-up surveys to measure their outcomes. An increase in hits for best practices, adult and youth web content pages, training participants in clinical best practices and training, follow-up surveys to measure their outcomes, web-based surveys of youth about their knowledge of and attitudes about suicide, intermediate goals for the number of youth engaged with the National Center, with the longer-term goal of reaching 1 million youth. the development and dissemination of common messaging with other suicide prevention organizations, a number of products developed in common with other suicide prevention organizations through a new collaborative group, 5 national and 20 state organizations participating in the new collaborative consortium. Since the National Center was only recently launched, we will begin by setting baseline and target measures. We aren't tracking outcome data yet, and some of the measures require long timeframes. Additional short and medium-term outcomes related to our target audiences will be generated as our programs are developed. It is important to know that the National Center will follow the same practices as our parent organization, the American Association of Suicidology. AAS is a leading organization for suicide prevention best practices and evaluates and publishes information about outcome effectiveness for its programs. Suicide is a highly stigmatized and emotional issue for many people, so there are a number of misunderstandings that the National Center for the Prevention of Youth Suicide will address. One misconception is that few people are affected by youth suicide. Although suicide is a relatively rare event, it is the 3rd leading cause of death for our kids. For perspective, the most recent data show that there were 5,500 homicides and 4,500 suicides for youth and young adults in a single year. The impact is huge. For every youth suicide, there are approximately 80 people directly impacted by suicide loss. Another misconception is that suicide is an individual issue of choice. Nearly 90% of young adults who die by suicide have a mental illness or a substance abuse disorder, and many could not get effective help. Many people mistakenly believe that if a youth is prevented from dying by suicide, he or she will just attempt again. However, the majority of people who survive suicide attempts go on to die of other causes. When people hear the name National Center for the Prevention of Youth Suicide, many assume that we run a crisis hotline. One priority of the National Center, as well as the Action Collaborative, a consortium of North American youth suicide prevention organizations, will be to correct this misunderstanding about suicide prevention. We are focused on research-based practices and educating the public. To correct misinformed ideas about suicide prevention, we educate people about ways to prevent suicide. Let me tell you a little story to exemplify what I mean. There was once a village that bordered a waterfall. The villagers would see babies floating down the river and rescue them just before they went over the edge. But some villagers thought they should look upstream and determine how the babies were falling in the river in the first place. That is the approach that the National Center is working to promote. Obviously, for suicide, last-minute crisis rescues are tremendously important, and crisis services have saved lives, just like the villagers saved babies at the last minute. The National Center and other suicide prevention organizations will continue the work of promoting crisis services among youth and the adults who care for them. However, also very important to the National Center's work is what we call upstream prevention. Upstream prevention intervenes in young people's lives to promote mental health and the resilience of all youth and address risk factors before a crisis occurs. For instance, we are reviewing research about practices to intervene in a depressed youth's life before suicide becomes a viable option. The National Center is also involved in promoting protective factors, such as training clinicians about effective care of suicidal youth. The importance of framing the issues around suicide and campaigning for suicide prevention cannot be overstated. Since mental illness and suicide are both issues surrounded by stigma, many mentally ill or suicidal individuals feel alone and isolated. To build a stakeholder community, we need people who are accurately informed and who believe that suicide is preventable. The American Association of Suicidology is well established with decades of disseminating groundbreaking research that is presented at our yearly conference, on our website, and in our journal, Suicide and Life-Threatening Behavior. These research findings form the basis of our best practices trainings and consensus statements, expert statements such as guidelines or protocols. In turn, these AAS products have helped people understand suicide and have helped organizations design interventions and programs to prevent suicide. AAS's National Center for the Prevention of Youth Suicide is a young organization. However, we can already list some accomplishments. The message, "No child lost to suicide," has reached youth, parents, and youth caretakers throughout the country through the website and outreach. A number of youth, parents, and teachers have contacted us as a result. The National Center advised the federal agency leading youth suicide prevention efforts on future directions at a 2-day meeting of 20 invited experts. We are developing the Action Collaborative, a group of youth suicide prevention organizations committed to developing consistent messaging about suicide prevention for social change. The National Center initiated, co-sponsored, and scheduled an institute for researchers, survivors of suicide loss, and prevention practitioners on expanding the youth suicide prevention paradigm to include upstream prevention, that is, preventing youth from even thinking about suicide and preventing suicide risk factors by promoting mental health and addressing risk factors. The National Center is forging alliances with Casey Family Programs and the Child Welfare League of America to develop practice standards and to advise on critical issues for youth in foster care. The National Center is a leading member in a national group addressing suicide risk among lesbian, gay, bisexual, and transgender youth. Through partnerships with researchers, we widely disseminate a series of practice briefs. Our first series, Someone Needs Help, I am suicidal, I am worried about my friend, or my son, daughter, student is suicidal, came out in the fall of 2011. These are just a few initial accomplishments of the National Center. We could do so much more with your help, making a difference in our kids' lives and in our futures. Although the American Association of Suicidology is well established with decades of groundbreaking research that has helped people define and understand suicide and address its prevention, the AAS National Center for the Prevention of Youth Suicide only began in 2010. Therefore, our challenges center around startup pains that most nonprofit programs face. We have lots of knowledge about effective suicide prevention, but our hands are tied until we secure more funding. Specifically, we are trying to develop and run a program while simultaneously raising funds for it. We have a challenge grant that matches individual donations, plus we've been given funding to develop an institute. Meanwhile, it is challenging to raise money for our infrastructure. For example, for website development, we need support not just for technology and design, but also for the staff time to generate research-based content and to lead reviews with youth and young adult audiences. We have already stretched our resources by supplementing our staff with college interns and arranging pro bono assignments. The National Center's partnerships with organizations that serve high-risk youth, organizations previously unengaged with suicide prevention, have potential for funding projects, but building these relationships and securing those funds takes time. Historically, foundation and philanthropist funding has been minimal for programs supporting mental health and addressing mental illness, perhaps related to stigma. This is slowly changing as mental health is seen as integrated with and crucial to overall health, and the possibility for recovery for people with mental illness is understood. Meanwhile, some funders may continue to avoid programs that address suicide and mental illness, but may be interested in promoting youth well-being. We plan to generate interest among funder affinity groups that are interested in youth, including youth empowerment and volunteerism. The new center embodies the AAS mission to understand and prevent suicide. The AAS board made a commitment to support the National Center's startup. Fundraising continues to be important to the National Center. However, at this early stage, it is crucial. The National Center for the Prevention of Youth Suicide at the American Association of Suicidology is ready to engage with donors to develop a number of projects. The National Center has begun or has initial plans for the following projects. Help us bring them to life or to scale. All of them are related to our mission of saving our kids from dying from or attempting suicide. First, a grassroots campaign to engage 1 million youth in suicide prevention. A priority of the National Center is engaging high school students through outreach. With our modest initial outreach efforts, a number of students, parents, recently bereaved youth, and teachers have responded. So you understand the scale of this work? The center director is overseeing 1 student intern in this work part-time. With additional staff, we will ramp up the contacts and begin work with national youth organizations and bring our outreach to scale. With your help, we can reach our goal of mobilizing 1 million students. Help us with our second strategy for building high school student engagement, building the National Center's information infrastructure, starting with our website. Whether youth know about suicide from peers' deaths, or reading about youth who die by suicide, it is important that they find the National Center's information and that it follows science-based guidelines for safe messaging to avoid risk of suicide contagion among youth. The National Center's current web pages offer resources and advice. Web information in the second phase will be interactive and youth-generated and include polling and youth-generated materials such as blog posts and video stories and social media. Your funding will give us resources for technical and design expertise to develop our web presence as a youth go-to site and as a site of reference for our adult audiences. Second, materials and training for providers and caregivers of youth at risk. To date, much of the work of youth suicide prevention is aimed at all youth in a school, community, or state. However, the National Center believes your resources will be better leveraged by strategic efforts to identify and address youth and young adults at higher risk. Help us in our work targeting at-risk groups, youth in foster care, bullied youth, and lesbian, gay, bisexual, and transgender youth. Our strategy is to translate and promote research-based information and interventions. However, developing new individual and organizational relationships with organizations that serve these youth takes time. Another at-risk group the National Center would like to target is youth who have already attempted suicide. Youth who have attempted are at the highest risk for dying by suicide. Your support will enable us to reach out to emergency departments to collaboratively develop research-based information and best practice training. Third, promotion of warning signs for suicide. Most youth give warning signs that they are considering or planning to take their lives. We have research-based warning signs for suicide, as well as advice on what to do, but we need your help in making suicide warning signs as recognizable as the warning signs for heart attacks. Recognizing the warning signs and knowing what to do can save lives. With additional resources, the National Center will work with marketing and public health professionals to design a campaign. Your funds will help make warning signs for suicide common knowledge, ready to be acted on by peers, parents, and teachers. Fourth, follow up on action steps from the Upstream Prevention Institute. The National Center initiated and is co-sponsoring an institute on expanding the youth suicide prevention paradigm to include upstream prevention, that is, keeping youth from even thinking about suicide and building resilience for youth generally. Your additional support will fund staff follow-up work, for example, additional blog posts and journal articles, increased outreach to leaders in cross-cutting issues such as substance abuse and violence, webinars to teachers and youth-serving professionals, and information and training material for suicide prevention audiences. The National Center has identified these projects in its strategic planning as having the greatest likelihood for making a difference in youth suicide prevention. Your donation will help us fully realize these projects. The National Center for the Prevention of Youth Suicide at the American Association of Suicidology has identified gaps that follow the National Center's mission, but for which we currently lack the resources. First, a Youth Suicide Prevention Unconference. The term unconference can mean a lot of different things, but we are focusing on bottom-up development, youth-developed topics and formats, low or no cost to participants, and use of technology. Help us use this unconference to empower youth as activists and social entrepreneurs, building a social change movement around youth suicide prevention and the reduction of stigma about mental illness. Your support will start us on our way to getting 1 million youth engaged with this issue. They will be leaders in their communities and inspire other stakeholders. Second, American Association of Suicidology has developed a number of trainings, especially for mental health clinicians. Your support will support our focusing on clinicians who work with youth and enable us to look at systems. For example, it doesn't make sense to refer youth in crisis to care if the clinician is ineffective. Help us with additional resources that will support an adaptation of the AAS training, recognizing and responding to suicide risk for clinicians who work with youth. Third, the National Center, through its relationship with the American Association of Suicidology, has access to science through the top researchers in suicide prevention and access to experience through survivors, members who are bereaved by suicide loss. Additional resources will enable us to partner with scientists and survivors to translate research and experience to practice, to apply the findings in settings youth frequent or to youth at highest risk, and to bring to scale interventions that have had demonstrated success. You can help us to widely disseminate a series of practice briefs, short, printable web documents that describe practical applications of research findings for people who work directly with youth. These projects are all part of the National Center's strategic plan, and we need your help to see them accomplished.